Straight away you can see the gene of the corpus callosum. That's a good start.
Can you hear me? Okay.
Right.
So now that I am looking at the field of brain in the coronal section, and you can recognize the two eyeballs here, and this is the midline, and then here you can see this is the anterior horn of the lateral ventricle, and you can see, and here you can see this is a septum pellucidum, and how do you think this is here, and if you look at the field of brain in the anterior part, Simon, how do you think?
So I think the good news is we can see the geno of the corpus callosum. We can see the cingulate gyrus. We're doing parasagittal or sagittal, and now we can see the corpus callosum. Beautiful Ritsuko.
And however, I think that this is a 28 weeks of gestation, right?
Yeah.
And then the most probably that this is a bit shorter. How do you think?
Yeah, I agree. So this is where we now want to chart the corpus callosum. So we see the rostrum, the genu, the body. We have not seen the splenium yet, but we'll come back to this. But that's 28 millimeters. And now we can measure our distance between the occiput to inciput, the internal occipital frontal diameter. But the good news in this case is that now we have seen that the corpus callosum is present. We can see the cadence septum pellucidum is triangular in shape. Do you want me to drive the machine? Do you want to? Okay. Do you want a volume? Okay. So we. Okay. So we're looking at doing a 3D volume, and I'm waiting for Ritsuko's instructions. I'm going to select a wide region of interest, exactly where the baby's head is. I'm setting the quality to max. The volume angle is taken down to 80, and now we're acquiring, hold your breath please, 5, 4, 3, 2, 1.5. Breathe away normally.
Okay.
Super.
Okay.
So we save that before we lose it. And now watch Ritsuko do her magic. So we go to multiplanar, sepia, reference dot in the cadence septum pellucidum. The plane shows the CSP. It's translating through the volume on the A plane.
If you look at this volume and the plane ABC, and most probably many of you are thinking about the thin corpus callosum, and it might be shorter than normal. But besides that, if you look at the Sylvian fissure, here you can see this is the vertebrae A, and this is the 28 weeks and 4, already 29 weeks of gestation. I have the suspicion of the premature Sylvian fissure in this case.
Okay.
Maybe later on, this looks like a 26 weeks of gestation for me.
Yeah.
And maybe later on, I will.
Yeah. Do you want to measure? Show us how you do the angle.
I can measure the angle, and this is the angle 2 lines, and
that's very helpful to see the technique of Ritsuko. So the first line goes perpendicular in a straight line from left to right, 3 o'clock to 9 o'clock. And then the second line goes in the up line of the Sylvian fissure.
Yeah.
Yeah, beautiful.
So, okay, so I think maybe my routine is like the type, the TOI, like this, and I look at the baby's brain, so from the front to posterior, and also here you can see I am looking at this is not so the very good image, and however you can see this one, the maybe the Nguyen is saying that that there might be some irregular surface of the vertical wall, but it is not so irregular.
Can you come back to the corpus callosum in the midline? And when you look at the corpus callosum, I agree with you that it looks thin. But this is the point that you made with Tsuko. There's not much point in measuring that, right? It's more important that your subjective assessment rather than measuring. Can I ask you what you think about the line halfway through, and if you could show us the landmarks of the telea choroidea and why it's important?
Yeah, I think sometimes we see this membrane like the septum inside of it, and that is divided into the
Okay, the septum and the vergae.
yeah, right. English pronunciation. And then, so I think that this is the septum here, but it is critically, it is not so important.
Okay.
Significant.
And can you point out the telea choroidea and why that's important?
Yeah, choroidea, here, I think that this is one of the landmarks for me to measure the Sylvian fissure angle and to see the here. So put the point, the dot on the tip of the telechoroidea here.
Yep.
And then I look at the
Sylvian fissure.
Sylvian fissure.
Beautiful.
Yeah.
Beautiful.
And also, if this dot is going to anterior,
Is the dot on the B plane? Yeah, or on the B plane?
yeah, dot,
Okay.
and then almost between the anterior part of the corpus callosum to the here. There is someone, this one.
Yeah.
This is the very small, but this is called the olfactory
Bulb.
sulcus. Olfactory sulcus.
So when you look at that Ritsuko, you're using the B plane and putting your reference dot at the level of the where the gigot joins the body to bring the olfactory sulcus. Beautiful.
Okay, so usually I look at, but recently I am looking at the olfactory now, this height, and then I have some suspicion of the olfactory sulcus is a little bit shallow than the
You expect.
Yeah,
Okay.
in the 28 weeks of gestation.
And can we look in a second? Can we look at that in real time as well? Can I ask you, does the tectum plate important to you? The tectum plate, just in terms of coming down and seeing the
Tectum.
Yeah, the tectum. Or not important?
I don't so much the focus on.
Okay. So let's go back to real-time imaging, and can we just show me the anterior complex again? Do you think the anterior complex looks normal when you look at that, when you look at the anterior horns? Because I was saying when I was scanning transabdominally that I thought that the anterior horn was pushed laterally. Yeah, do you think this looks more like a Viking horn's appearance?
Yeah, I think that this shape,
Yeah.
the septum velocity is a little bit wider, they do measure that, but
Yeah.
I think, they usually much thinner.
Yep, I agree. And in terms of the olfactory tracts, if you can show us how you look at those in real time?
The real time here.
Yeah.
This one and this one.
So just you come up from the orbits, come back from the orbits, and
Yeah,
then see.
right.
Okay.
And so far there's no reports on the measurement of the
olfactory.
So we
Okay.
are now measurement of the olfactory, the rehab protocol. But in this case, it might be normal.
Yeah. Okay.
Sorry, I didn't have.
That's okay.
But
That's okay.
most likely.
Okay. The sagittal image of the lateral ventricles. Can you tell me whether they look okay? So we're looking for any periventricular nodular heterotopia. We're looking for any bands and strands of CNP, any echogenicities in the caudate nucleus ophthalmi. So no to all of those from Tsuko.
Yeah, but my concern is about the premature fissure and the thing
Goes close. So what would you do with Tsuko? What do you think we should do next?
Usually, in this case, I go to the sequencing.
Yeah?
And also, I send the patient to MRI.
Yeah.
Yeah.
Okay.
So-
Any questions from the audience before we finish up this transvaginal scan?